Hey guys, Dr. Gilmore here. I want to thank you for watching our videos, and I also want to thank all of you that have purchased Meta 7. If you purchased your Meta 7 on Amazon, I need a special favor. I need you to go back onto Amazon and give us a really good rating. 5 stars. I really appreciate it. Thanks a bunch. That's one tourniquet down. This actually helps the anesthesia work a little bit better.
Take my finger off.
I sure did. Like that little gator. I was telling Nimbus here that I just got back from my vacation trip to New Orleans and that her toenails reminded me of the eye. Nolans, I'm sorry. Reminded me of the eye of this baby gator that we all got to hold. I might have put a picture of that in.
He's blind?
They have an opaque kind of covering over their eye. Okay, so we're going to give you a few minutes for this medicine to work. Does that sound like a good idea?
Yes.
And we'll be back with you, and we're going to get rid of these bad nails.
Okay.
Gumby Jean, are you ready?
I am. Are you ready?
I don't know. I'm going to give it my best try, though.
Do you usually assist him for this?
Yes, ma'am.
Well, good.
She's a great assistant.
She's got experience.
She does. All right, I'm going to gently lift up your toe here and see if I can't slide a nail lifter underneath and see how much of this may still actually be attached. Not a whole lot, I don't think.
Yeah, it looked like one of them was going to eventually come off by itself.
I think given enough time, they probably would, but I think you'd be in a lot of pain when it happened.
Yeah.
Yeah. All right, I'm going to come around here and kind of brace that toe as I push the nail lifter in. There we go, good. I'll tell you, these are kind of challenging. Really, really unusual shape.
The curvature.
Reminds me of a shell.
Like a seashell.
Right, it does.
Yeah.
All right, I think I loosened that one. We're going to come over and loosen the other one. Gumby Jean, can you see all right?
Yes, sir.
All right, good. Are you feeling anything? You might feel a little pressure, or you're not feeling any pain.
Yeah, a
right?
tiny bit of pressure.
A little pressure. That's okay.
Yeah, that's all right. I'm used to that from at the dentist's office.
Oh, really? Have you had to have a lot of dental work?
Yes.
Bless your heart.
One of my dentists told me when I was young, he said, because I was delirious, had the measles,
Mm-hmm.
he said, I think it affected your teeth because they were coming in and developing at that time.
Really?
So he thought they were more susceptible to decay, maybe, but I still have most of my teeth. I've had a couple of pulled, but
Mm-hmm.
I wanted to keep my teeth.
You're watching.
Ask God, please let me keep my teeth.
Please don't let me have to have dentures, right?
No.
Just put a gentle tug on this, and I can tell you, this whole nail is just popping right off of
Look
here.
at that.
Wow.
That was really an amazing nail. Look at that.
I don't think it's very amazing.
Well, I can tell you, I've seen a lot of these.
I thought, why do I have to live this long and to have this happen after all these years? You know, I've never had it before.
Mm-hmm.
Never had a problem.
And here you are. Well, I think if you make it to 79, you owe yourself at least one set of toenail problems. And I can tell you, I can tell you, you've done an excellent job of saving this. You really have. This is very impressive. All right, Gumby Jean, she moved a little bit. I think I pulled her foot over. Can you still see okay? All right. So we're down to one, and this one's coming loose. I don't want that scissor get in the way. Or a hemostat. There we go. Coming right out of there.
That's so
Nimbus,
cool.
you are doing a great job.
Thank you.
She's a tough one.
She's tough. Now, are you feeling any pain at all?
No.
All righty, good.
Is that going to hurt very much later, do you think?
You know what? I don't think so. But let me tell you what. I'm going to give you, I've given you, probably written it for you, a prescription for some pain pills, just in case you need them. Now, you said you were allergic to the tramadol.
No,
I mean,
I'm
to
not.
a codeine, so we're giving you tramadol.
Yeah.
Can you see that pretty well, Gumby Jean?
Yes, sir.
All right. Well, those are some special toenails. I don't really have a lot more to say about them. But we, just as we got started, we had somebody come in here and draw some blood so that we can check your liver function test and make sure it's going to be okay for you to take the Lamisil. We're going to go ahead and give you the prescription for the Lamisil today. Of course, if we get results back that say that you can't be on the Lamisil anymore, then we'll call you right away and let you know what else to do. But in the meantime, you're going to keep these clean and dry. We're going to put a dressing on these for you. And if you'll keep these dry for 3 days, you'll experience very little discomfort. Now, you might need one of those Tramadol tomorrow. And so I suggest you take one if it hurts. And otherwise, you just start taking the Lamisil, which is terbinafine, once a day. And I'll see you back in 60 days. At that time, we'll recheck your liver test to make sure that your body's doing well with the antifungal medication.
Okay.
All right? Do you have any questions for me, Nimbus?
No, I was just wondering if, it was okay because I did have, my blood test done.
Mm-hmm.
And they said the enzymes were a little high.
And that's pretty normal with an American diet. We tend to get a lot of sugar in our diet, and that sugar causes a condition called fatty liver.
Oh.
And fatty liver, is part of that fatty liver condition is elevated enzymes.
And
Would
that's
you like to take a look at these real quick, sir?
Well, I know what they look like because I had one like that come off.
You did? All
Because
right.
I had dropped I had dropped something on my foot,
Mm-hmm.
and I worked with it about noontime. Well, this been a little while back, but
Mm-hmm.
it wasn't that long ago. And my foot felt warm, so I took my shoe off, and my sock was half full of blood.
Oh my goodness.
And what it did, it knocked that nail off.
Hold that toe right there. Can you feel your other toe?
Oh, yeah, I feel
Okay.
my
Of
second
course, you
toe.
probably wouldn't want to hear what I did.
Uh-oh.
Well, I cleaned it up.
Mm-hmm.
I put peroxide on it,
Mm-hmm.
and then dried my sock and put it back on and worked the rest of the day.
Did you see? I'd have used some duct tape on there.
Well, I mean, I don't know. I guess I keep peroxide wherever I work.
There you go.
Oh, he's a peroxide. But
They
anything,
say, well, it kills the good germs
Anything
too.
you
Nobody
get hurt.
kills the bad germs.
he tells, it has to be.
and-
Did you put some peroxide
And
on it?
I didn't have no more trouble with it. Of course, I did. When I got home, I did put antibiotic cream on it and wrap it.
Nimbus, you're a sport. Thanks so much for letting us record your procedure, and we'll get you fixed up today.
All right.
Go.
Wait, what was I supposed to?
Here we go. You're live. Talk to us now.
Okay, I'm taking a vitamin that is, I don't know the name of the vitamin. Start over.
This is just, it's embarrassing. You've been taking it for 2 months. You never read the label.
Dr. Juice. Okay, Dr.
You were
Juice.
taking my Meta-7.
Okay, I am taking Meta 7.
Yeah.
And so far that I've noticed within the first couple of months that I've been taking it, okay, that I do wake up. I do feel, when I do take it in the morning, I do feel a little bit more energetic, like a little more alert,
You're more alert.
energetic.
Mhm. Is it natural or jittery?
No, it's great. I mean,
It's
it's,
not
just
like
like,
you're
it's, no.
You don't feel like you just swigged down 10 cups of coffee, though.
No, absolutely
You
not.
feel good.
No, I feel good. I feel good. I feel, and then I also noticed that I haven't really changed my diet habits. And so actually I eat kind of, I enjoy things, I eat my dessert. And I haven't gained weight.
In fact, I
So-
just checked your chart. You did lose 1 pound.
I mean, it's amazing. I cannot believe that has happened. Okay,
for you.
because I do enjoy my life. I mean, I enjoy eating. So anyway, so it's been good. And I'm gonna keep and continue. And
I want to play, see if I can find a
Get
big
a good one so I can put it as my school computer background so people will freak out.
Hold it up in front of your face more. Not too close, but there you go.
Now look at me and do it.
You're good.
Okay.
Look at that, darling.
Now, if you choke them, you're
Wow.
giving them out to my wife. Get a man.
Smiling.
Now, if you'd have went in the park or the zoo in inland, right before we fire, you get burned. They would have had a rubber band.
Stay tuned for the Meta 7. I took mine today. How about you? I'm actually.
You told me you weren't sharing your regular medicines, but
I was sharing Dr. G's medicine, my Meta 7,
yeah.
with some coworkers and my boss in the office, and they love it. And we all haven't been sick. We've all felt great. We've all had energy. And I've gotten everybody to hop on board with me.
Yeah,
So-
and your boss actually, you were supposed to come buy a bottle for your boss because she loves it, right?
Yes,
And
but I didn't do that.
Got the checkbook.
I did.
It's
so
okay.
it's okay.
All right.